fully end-to-end cardiovascular disease diagnosis system. Merely, in plain words, we are focusing on preventing heart failure, heart attacks. And our main focus is ischemia. This is the area affected by lack of oxygen. This area where the blood doesn't flow enough and doesn't receive enough oxygen. So generally, heart and cardiovascular diseases is a vast problem. 1 out of 3 deaths are caused by cardiovascular diseases. So the number of patients and potential benefactors of the system is vast. Generally, we focus on designing a system that will be both used for the serious cases, for the cases of high-risk patients and patients that need some initial diagnosis, some initial assessment. And generally, what happens when you have a heart problem, heart disease problem? You are taken to a hospital as fast as possible, and then you are given a number of tests. So there's an ECG test, there's a heart echo, there's stress perfusion test, or there's CT test, and the golden standard nowadays, which is coronography. The coronography is always done in the severe cases, and it's very risky and time-consuming. Coronography can cause artery dissection. The previous methods are very time-consuming and not cost-effective. So what is the solution? We are using a set of AI solutions, some deep learning solutions that analyze the geometry of the heart, of the arteries, of the ventricles, and analyze how would the blood flow through the heart, and analyze which areas would not receive enough oxygen. And this is actually the ultimate answer that the doctor needs. What is the area that doesn't receive enough oxygen? So up to now, there are several methods given by our competitors which analyze the geometry of the heart using some deep learning, but they stop midway. They just give half-processed data to the doctors. And this data is very hard to analyze for the doctors, as research shows. So what we do, we have another neural network that analyzes all this data and does this very statistical job that now is done by the doctor and show, okay, the ischemia area, this affected area is this or that large, and it's here or there. So where are we? We have accomplished a successful proof of concept. We have issued a PCT patent. We have a very good team, which we are proud of. And we have developed a thorough strategy. So currently, we just finished the research and development phase 1. We have the proof of concept working. Now we are heading to phase 2, where we seek some investment for the CE and FDA procedures certificates. Having those, we can continue to go on with the commercialization phase. And this is our team, which comprises of people from the AI world, mathematics world. There's a physician, there are clinicists, and people from the world of business. So if you look at our strategy, the thing is that such devices, and this is what we are planning. We are planning to use software as medical device. They need certification. So in order to get into the market, we have to accomplish the FDA and CE certificates. And generally, we are sure that we might get it, since this is exactly what the clinicians need, and it's quite easy to prove the efficiency and this system to be precise enough. Having the CE certificate, we can go on to Europe. Having FDA, we are planning to commercialize in USA. Thank you for listening. So that was the heart-related system, AI Hexoract.
Thank you, Björn.